Everybody that comes here is active until you can't be active, but there's so much to do. Normally I play left field or shortstop or what we call short field, which is behind second base, and you can play infield and short field, third base or first base. I'll play any position. I began having back problems about 4.5 years ago. And I went to every doctor imaginable. I went to pain management doctors. I went to orthopedic surgeons. I went to acupuncture. I've had epidurals. And they all said it was my hip. So I had hip surgery 4 years ago. And I was pretty good for about 6 months or a year after that. And then it acted up again, and I had the same symptoms that I had when I had this hip surgery. So I went to one of the seminars in the villages here with my community, and I was listening to a doctor from Ocala who specialized in back surgery. Now, there's a rotary here, and across the street is a championship golf course. And this goes out about 4 miles out, and there's a Nancy Lopez golf course, and we have another shopping center. In the long run, I ended up having the back surgery where I had my 4 and 5 disc fused. Well, that lasted about 6 months without pain from the fusion. But after that, I started getting the pain again, and it was worse than the initial pain I was getting. And so that was about 1.5 years ago. So I suffered these back pains for 1.5 years and kept going back to the doctor that did the surgery, and he would give me cortisone shots, and they did nothing. So they told me to give up what I'm doing, like playing softball, which is my favorite sport. I used to play golf a lot. That was my main sport until I started with the softball. And he said, give that up and take up an easier hobby. Well, it's kind of hard to do when you like something and see all the other fellas doing it. So I tried to get to see 2 neurosurgeons in the villages that have treated other patients. And I was told I needed an MRI and a referral from my family doctor. So I got both. And the family doctor said he'd make the appointment for me with one of these neurosurgeons. If I couldn't get one, he'd get the other. Well, as it ended, neither one would see me because of my previous surgery, because it was less than 5 years that I had the surgery. So that day I got the word from the doctor that I couldn't be seen. I went online and I just punched in back surgery and so forth, and I pulled up Dr. Deuk's website. Well, I was very impressed with the website. And in the website, there was a spot where you can put in your name, email address, and phone number, so forth. And the very next morning, I got a call from one of Dr. Deuk's assistants. His name is Jason. Well, Jason couldn't be more personable on the phone. And when he knew I was coming from 100 miles away, he even tried to make it easy for me by saying, I want to get you in early so you don't have to wait. So he was concerned about that. So just that rings a bell. So when I got to Dr. Deuk's office, I was very impressed with everything. The office, the personnel, and their mannerism. I was expecting them to, from what I could read of the report on the x-rays, I thought it mentioned bulging discs and spinal stenosis and also scoliosis and that. And I thought that he would do the procedure with a laser where they would cut out the bad areas of the spine. And I was kind of disappointed when he said, no, we're not going to do that. He said, because that is still surgery. And when you can eliminate surgery, that's the way to go. So he said, we're going to inject some cortisone shots into your facets. It's called a spinal facet injection. And the next week I went back and I had that done. And when I got off the operating table, it's mini surgery. I wasn't put under. I knew everything that was going on. And when I got off the table, I was out of pain. I came home and I couldn't believe it. I was like a new man. I said, I just couldn't do enough around the house because I felt like doing it, because it didn't hurt. Before that, I couldn't get out of the chair. My wife was doing everything for me. I went about three weeks or so, and then I tried playing ball. Well, all during the ball game, I had no pain, and I hung around and watched 2 games afterwards, standing and sitting, and had no pain. You won, you lost.
I caught that ball, by the way.
Did you? The one I hit?
Yes.
I didn't think it went that far.
You were out.
Dr. Deuk does not believe surgery unless it is absolutely necessary, and he said he doesn't believe in drilling holes through the spine because it weakens the spine. Well, you know, you just take what they say. Most doctors won't even tell you anything. They'll say, oh, we can do that, we know what it is, and it's it. But Dr. Deuk explains the whole thing. The surgeon that did my procedure with the 4 and 5 fusion, every time I'd go back to see him, I would see his assistant. I had never seen him, you know, afterwards in like 2 years. And the physician's assistant said, you got to take up a new hobby. You can't do that. And Dr. Deuk, just last week when I saw him, said, you do what you want to do. He said, I don't believe in anybody just sitting in a chair vegetating. He said, you do whatever you feel you can do in moderation. He said, if it hurts, you just knock it off. But he says, do what you want to do. I don't believe in telling anybody not to do this or not to do that. I couldn't bend like this before Dr. Deuk took care of me. Walking would have been a problem. Just standing was I couldn't stand. I'd have to keep sitting down. And now I could do anything. As far as getting out there and not having any pain, it was just like being born again, a new person.